Hey everyone, welcome back to Unfulfilled. I'm your host, Camille. Thank you so much for joining today. Today, I am joined with Rachel Blank, founder and CEO of Allara Health, a collaborative care platform for women with chronic health conditions and offering women the specialized care that they deserve. Rachel, welcome.
Thank you. Thanks for having me.
So let's dive right in. Why is it so important to prioritize hormone health?
So I think people don't realize, but your hormones truly are at the root of so many of your body's functions. And actually, at some point in our lives, women will undergo a multitude of hormonal changes and likely one, if not many, kind of hormonal issues, let's say, that they find themselves needing to deal with. So, for example, we see that a lot of women, actually 1 in 3 women, has a hormonal condition where their hormones just, once you hit puberty, your hormones just are off at baseline. So that could be a condition like hypothyroidism, where your thyroid is underactive. Could be a condition like polycystic ovary syndrome, where your hormones that are your kind of like testosterone and estrogen hormones are off balance. So that's where we see things like excess testosterone making acne symptoms, and then also affecting your insulin resistance, which insulin is also a hormone. So, really it affects so many issues in your body. And then even if you're not one of those 1 in 3 women that has a hormonal condition, likely you're going to have issues and changes with your hormones, right? Many women will get pregnant at some point and then we'll deal with postpartum hormone changes. Every woman, if she lives long enough, will experience menopause when you have a whole other host of hormonal changes. So I think we've just really either not talked about hormones for very long, or I kind of put hormones in this wellness bucket where, hormones are kind of the alternative medicine thing that we don't really need to worry about. And it's not real science. And in reality, actually, hormones are not only very real science, they're actually very, very important things for all women to kind of understand and keep track of throughout their lives.
Yeah, couldn't agree more. I would love to hear your further thoughts on this, but a primary reason that you've created Allara Health is to allow women to seek this guidance and consultation when it comes to hormonal health and chronic conditions. So, where do you feel that there are gaps in our society and medical services when it comes to women being able to monitor and get support for their hormonal health?
Where do we start with the gaps in women's healthcare is really the question. Like, what isn't broken in women's healthcare is almost more of a question.
Mm.
But, I think something I've always noticed. So for context, my dad is actually an OBGYN. He runs a large OBGYN practice in DC.
Oh, very
And
cool.
literally to this day, anytime we go out to eat, we go out to dinner, like I'd be a kid, we'd be walking through the mall, no matter what, we'll run into somebody who's like, "Oh my gosh, Dr. Blank, it's so good to see you. Here's the child that you delivered," or "It's nice to see you. I've been seeing you for 30 years now." And just he's like the mayor of DC. Everybody loves
Wow.
him. So I was always so confused when I got older, because I was like, how is it possible that all these women are obsessed with my dad and thought he delivered such incredible medical care? And yet at the same time, so many women, myself included, are so frustrated with the health system.
Mm.
And as I kind of researched more and learned more, I realized it's really comes down to a couple of things. I think one, a lot of it actually is not necessarily the doctors, it's the format that they're practicing in. So there are a lot of fantastic doctors out there who want to deliver really great medical care, who can deliver really great medical care, but the current format that they're practicing in is really hard to do so, right? A lot of doctors' offices now are owned by private equity backed conglomerates that care about margins and profits. Not that we don't, but something that all businesses have to think about. They, are seeing 6 patients an hour. They're seeing patients back to back. They're very quick visits. And oftentimes, a lot of times, these OBGYN visits are really primary care visits. So by the time you've done your 12-minute visit of you undress, you do your checkup, you do your breast exam, you do your pap, you do your primary care talking points, there's not really enough time to dive into the complexities of anything else. And what I found is that there really was no other format that women really had to meet with these types of care providers, right? You had your in-person OBGYN and that was kind of it. And so really the idea behind Allara was to take these incredible doctors who wanted to deliver more care, who wanted to spend more time with patients, and give them that chance to have an extended relationship with their patients. So at Allara, it's all virtual visits. So we don't have the cost of the overhead of an in-person office. That allows us to have our providers spend much more time with their patients. So our first 2 visits are 30 minutes with the medical provider, and then 15-minute follow-ups after that. Also, as many as you need and done pretty quickly. So unlike traditional health offices where you might have a 3-month wait to get into a provider, you can see ours within a week of when you need it. And the other thing that we found is actually if we get rid of some of the other stuff the doctors have to deal with, we get rid of some of the admin burden, we have all of our patients also have access to a registered dietitian. So now the doctor doesn't have to do nutrition therapy. We have a specialist in nutrition who's meeting with the patient. So also allowing every provider to do what they're best at and what they're expert at instead of having them try to do everything. So that to me was actually one of the biggest things was how do we make actually the process not just work better for patients, but work better for providers so that they can deliver better care to patients. And the other thing I've really found in women's health is a lot of it is just really under researched and understudied. There is extremely limited funding that goes to women's health research. A small fraction of the NIH's research dollars are spent on women's health. And so that's actually something we invest a lot in at Allara. We're actually building the largest patient data set of PCOS patients and other patients with hormone health needs. And so we actually, as we're treating patients, we're also ourselves doing some of kind of the data analysis and the investigation of how do we treat patients better? What do these patients have in common? And actually trying to do some of the research ourselves.
I think that's so great because, as you mentioned, when it comes to women's health, especially hormonal health, it can be a whole multitude of things, and you don't get that care and consideration of detail and attention by all these different specialists to kind of get to the root of the cause when you just go to a general doctor or an OBGYN. So we are going to dive into the weeds of PCOS and hear your story on it, because I personally would also love to learn more, especially because it impacts so many women, often without us realizing it. But before we dive into that, what are some of the biggest myths or misconceptions that you hope to help shift or help women unlearn when it comes to hormone health?
I think that's great. One thing that is really important for women to realize is that it's not all seen on the outside of your body. Sometimes you need to do testing to understand what's going on kind of behind the scenes. So, there are kind of textbook cases of some of these conditions, right? So a more textbook case of PCOS is a patient who presents who's more overweight, who tends to have acne issues, who tends to have excess facial hair, tends to have hair thinning. I was a patient, and actually there are a lot of these patients who didn't present with any of those things. I just had really irregular periods. But my whole life, I haven't really struggled too much with my weight. I haven't struggled too much with acne. I've had 10 pounds here and there, acne here and there, but nothing that a doctor would see that they would say, oh my gosh, we have to deal with this. And that's also a huge thing I've noticed, what a doctor will make time to deal with versus what you feel like needs to get dealt with. There could be a gap there. And so I just happened to get diagnosed kind of as a fluke while I was investigating other things. But I think what happens is a lot of times women, they don't necessarily present with a symptom, and so they don't get testing done. And you almost in some cases find out when it's too late. We have a lot of patients who find out that we see a lot of patients who find out that they have PCOS, for example, as part of infertility treatment. They've spent a year plus trying to get pregnant, and finally they go and get testing done and realize that they have PCOS. Well, if you had done that testing in your early 20s, you would have been so much more empowered to make better decisions, to handle that better, to maybe get yourself pregnant faster than if you had waited all that time. And so I think the number one biggest thing is actually everybody can benefit from hormone testing. So at Allara, for example, we do the same testing on everybody who shows up. We look at your estrogen levels, your testosterone levels. We look at your thyroid function. We look at your cortisol levels. In most cases, we look at your inflammation levels. We look at your insulin levels to see if you're insulin resistant. So for example, I'm not necessarily overweight, but I'm insulin resistant. And so there are a lot of things that your blood work can tell us that you're not going to see off the bat, and that can be super valuable. And it's funny because we sometimes have patients who are like, well, there's nothing wrong with me, so that's kind of a bummer. And I'm like, no, that's amazing. That's amazing to find out that there's nothing wrong with you, but that was great that you got the test and found that out. So I think that's my biggest myth is you shouldn't wait for symptoms to get testing. Like a lot of people could really benefit from testing. And the second is that there's this like magic one size fits all approach. I see a lot of stuff on Instagram. Don't eat gluten and dairy if you have PCOS, or do this workout. And so many things are so specific to the person and require trial and error that I think there's a lot more personalization that should happen.
I love that. And so true. Every single body's different, right? So therefore, you need to take a different approach to whether it be diet or hormone health. So a big reason that you started Allara Health is your experience with PCOS. Let's start with the basics. Can you tell us what PCOS is and then share about your experience with it?
Yes. So PCOS stands for polycystic ovary or polycystic ovarian syndrome. It is diagnosed by meeting 2 of 3 of the Rotterdam criteria. So those are one, having presence of excess androgens, meaning excess testosterone, which we either can see in blood work, that's mostly how it's diagnosed, or through symptoms like excess acne, excess facial hair. Think about kind of like boy puberty symptoms. The second is irregular or absent periods. And the third is seeing the presence of ovarian cysts on an ultrasound. And it's a bit confusing because you don't necessarily have to have the presence of cysts. So you're diagnosed by having 2 of those 3, but you don't need to have all 3. And we know that anywhere between 1 in 5 and 1 in 10 women has PCOS. We don't actually know the exact number because, as I mentioned, women's health research is so bad and underfunded. But I feel like the more I talk to people, it feels more like 1 in 5 than 1 in 10. For my PCOS journey, I'm a bit more of a atypical PCOS case. I don't have as many of the outward symptoms, but I have always had a super regular period. So like I started puberty late and then I would get my period once or twice a year. And I think what's crazy to me is at the time I was like, oh, I guess it's just normalizing. I guess it's just going to figure itself out eventually and let it go on before I really asked anybody about the fact that I was getting my period once a year. And then actually I had traveled internationally and picked up some like crazy stomach issue from international travel. And in the process of trying to investigate this stomach issue, I got an ultrasound, and the ultrasound technician actually was the one who told me, did you know that you have PCOS? Your ovaries look like textbook PCOS ovaries. And I was like, what? I don't even know what that is. What are you talking about? And so I actually was really freaked out when I first got my diagnosis because it came as such a shock and a fluke. All I heard was, you're never getting pregnant, you're never having kids, which nobody told me. But when I started to Google it and I started thinking about it, I was like, oh my God, I'm like never having kids. Like it just felt very isolating and very scary. This also was nearly 15 years ago now. So it was just a very different time. People weren't talking about these things openly. I felt very ashamed about it. I felt very alone because there was just much less discourse. I think it's actually so incredible and such a boon to women that there has been so much more discourse and so many more women are talking about these things openly because it has helped so many of us feel less alone. And then that was like kind of it for 10 years. Like I went to a bunch of different doctors, but would hear things like, well, you're not obese and you're not pregnant. So what am I supposed to do with you right now? Because there was not like this big meaty thing to fix. They didn't really have time to deal with me. That was kind of the impression I got. And so I just kind of felt like, okay, well, I guess I'll deal with this again in like 15 years when I want to get pregnant. But then during COVID, actually, I started to really think a lot more about my health. I was, home. I was single at the time. I was thinking more about my fertility. I just turned 30. And I just felt like, oh my gosh, I have no clue what's going on in my body. And I've never really gotten the help or the resources that I wanted. And I kind of had this aha moment of like, this doesn't really exist in the health system. And actually I've been waiting for somebody else to build it, but it hasn't come. So maybe I should just build it myself because I think that's the only way that this is ever going to happen. So really, Allara started out of my own PCOS journey and really just feeling like we needed another option for care for women in the health system that wasn't just your annual OBGYN checkup.
Absolutely. That's incredible. Good for you. And the whole journey began.
Yes, exactly.
So beyond PCOS, what are some other signs or symptoms of hormonal imbalance?
Yeah, so a couple things. When we talk about hormones, we think about reproductive hormones like testosterone and estrogen, but actually there are many other important hormones in your body, like, for example, insulin, super important hormone. When you think about insulin, you probably think about diabetics, but actually a lot of times there's this overlap between women's hormonal health conditions and insulin issues. So for example, about 75% of women with PCOS are also insulin resistant, meaning that they also are at very high risk of developing prediabetes, diabetes, having pregnancy complications. So I think sometimes we talk about hormones and we think like female male hormones, but actually there are so many hormones in your body that matter. Cortisol is a hormone. I think cortisol is interesting because it's like a bit trendy right now. In reality, actually, if you have a serious cortisol issue, it's extremely serious. So there's like trendy cortisol, and then there's like serious cortisol. But, there's so many things in your body that are affected by hormones. So things you might notice if your hormones are off are, again, weight tends to be a really big one. A lot of your hormones affect your weight. Bloating and water retention, like estrogen tends to play a factor there. Irregular periods, obviously your periods are affected by your hormones. So If you notice extra painful periods or periods where you have really heavy bleeding or your bleeding lasts a really long time, like things like that can also be signs of hormones. Also, like fatigue can be a really big sign of hormone imbalances, acne, issues with your hair, anxiety actually can, not always, like sometimes anxiety is just anxiety, but sometimes anxiety is hormone related. And also PMDD, postmenstrual depression syndrome is a real thing. It's not just made up. If you notice like around your period, you get extremely anxious or extremely depressed, that could be hormonal. So I think I've listed like everything in your body
Yeah.
pretty much. But I always like to say, you know your body. If you feel like something feels off in your body, go ask a doctor about it and get a test done because you know your body best, and hormones affect so many things that if something feels off, it's worth testing your hormones.
Right. But if we are at the time of the month when it's our cycle and we're having these symptoms, would that be considered normal? And it's just abnormal if we're experiencing it at off times?
I think so. Two things are abnormal. One is like when it's happening. So are your periods happening like outside of that normal 28-ish day cycle? Are they happening every 2 months? Are they happening every 2 weeks? Are they not lasting for about 5 days? They're lasting for 14 days? Or you're having like nonstop periods? Like those are timing reasons where I'd say abnormal. And kind of also like you mentioned, if you're noticing like you're getting cramping throughout the month, like that's also abnormal. What's normal is like in that normal cycle period, you're getting normal symptoms that you feel like are manageable in your day-to-day life. So like you're getting some bloating, you're getting some cramping, but like you can pop in a leave and you can move on with your day. If you're like, oh my gosh, my pain is so debilitating, I can't get out of bed for hours, or I can't go to work, or I can't go to school, which we hear all the time from patients, or, you know, I need like Tylenol every 2 hours, or my bleeding is so crazy, I'm going through, you know, a tampon every every hour, or my like mood swings are so intense, I feel like I don't have a control over my mood. Those are things where it's normal symptoms, but the degree to which you're experiencing them is not normal. So those are, I'd say, the two things I think about in your period is, does the timing and frequency make sense? And does the degree of severity make sense?
Definitely makes sense. One thing I'm very eager to ask you, not just only because personally it does impact me, but I think a lot of young women can relate to this. A lot of what you've spoken to is monitoring your period. However, there's a lot of forms of birth control where we don't get a period every month. Personally, I'm on the IUD currently. I don't get a period. And so it's really hard for me to monitor when my quote time of the month is, you know, to see if my symptoms are normal and if they're timely. And I know with birth control pills, it literally has you on this cycle where it's almost like an artificial period. I don't know if I'm misspeaking there.
Yeah, that's
But
correct.
right. So if you're on birth control, you don't have that natural period. So how do you recommend women who are on some form of birth control and don't get a natural period monitor their hormone health?
Yeah, so I think a couple things. I'd say if you are like on your birth control, you're happy, you don't have symptoms, you're not worried about anything, you're not worried about like getting testing done, stay on your birth control. There actually are some tests that we can still do, even if you're on your birth control. And again, this is something you can talk through with your provider. So like, and then you also, what we have a lot of patients do, and things I've done in the past, is you might come off your birth control for a short period. You might come off your birth control for 2 or 3 months to get the testing done, and then decide from there whether or not to go back on. So that's something I've done at a few points in my life. I've gone off the birth control for like 3 months, have kind of monitored over those 3 months what happened to my cycle, gotten my testing done, and then went back on my birth control. Something I also think about is, for example, I'm at the stage of life, I'm getting married next year, I'm starting to think about family planning. So I'm talking to my Allara provider about, okay, when should I come off the birth control? When should I come off to do some ovulation testing? Like, how do I manage not wanting to get acne before my wedding, but also wanting to get pregnant? And what's the timing there? So that's something actually your provider can help you think through, is what's the strategy of maybe taking a break from birth control to monitor? That's where I think a lot of it actually comes down to, what are the goals you're trying to get out of what you're doing? So I've seen this thing on social media where it feels like on social, like birth control has become the new smoking. I'm like, when did birth control become so evil that nobody should ever be on birth control ever and it's terrible for you? That is not the case at all. By the way, birth control has some fantastic benefits. And it might be that you come off the pill, have terrible symptoms, like your cramping gets way worse, or your acne gets way worse, and you feel way better being on your birth control. So birth control actually has a lot of positive benefits. Even, for example, in PCOS patients, if you're not ovulating regularly, we want you on birth control to help reduce your risk of like endometrial cancer, because if you're not shedding your endometrium regularly, it can increase your risk of cancer there. So there are many reasons to be on birth control. So that's why I'd say, like, if you are perfectly happy, content, you don't want to get anything tested, don't need to worry about anything, stay on it. If you want to get testing done, you can work with your doctor to come off for a few months, get the testing done, and then figure out if it makes sense to go back on. So that's kind of how I would think about birth controls. Again, what are you trying to get out of it? And use that to kind of back into, okay, what do you do with your plan around birth control?
That's really interesting too that you brought up the negative stigma around birth control, because I have heard a lot of that. And I did used to be on the pill. I started the pill in high school to literally regulate my period because, similar to you, I was a very late bloomer and I needed it to kickstart my period. So I've actually never just had a natural period, which is like kind of weird to say. But then I shifted to an IUD. And personally, they've both worked fine for me, but I've heard plenty of horror stories about both of them because I think, similar to what you said before, hormone health is just so personal. You know, it's some women's bodies are going to accept one form and another is going to reject it. And I think it's easy for one person to project their story and then others to internalize it, to take it as such a negative thing. So that's really good to know.
Yeah, totally. And that's kind of why I like to say, like, if you're happy on your birth control, don't come off of it just for the sake of coming off of it. I think that's kind of been this thing I've been seeing of, do it the natural way. And it just doesn't make, like I said, unless you have a specific reason to change it. If you're experiencing symptoms, you should try around with your birth controls. You should try being on it, being off of it, try to figure out what works best for you. But if it works for you, then you shouldn't come off of it just because there's a stigma around it. I feel pretty strongly about that.
That's really good to know. Are there any long-term negative impacts of birth control?
Not, again, this is where I'm, disclaimer, I'm not a doctor, not any that we necessarily know of. There's some thought that it could take you a little bit longer when you're trying to get pregnant to kind of have it all come out of your system. So that's also something actually to think about. Like, for example, IUDs versus birth control. Those can be different in terms of if you know when you want to start trying to conceive, they can allow you to start trying to conceive. Some can allow you to start trying to conceive faster than others. So that's kind of something to think about. Also, birth control is contraindicated for certain patients. So if you're a smoker over 5, you shouldn't be on birth control because of risk of blood clots. If you have migraines with aura, you also should not be on hormonal birth control. So there are certain reasons that it might not be the best idea for you to be on hormonal birth control. There's other options though. There's the copper IUD that's non-hormonal that works well for a lot of those types of women. So that's, again, where I think it's almost this very like personal thing that it's really worth talking to your doctor and being like, okay, here are my symptoms, here are my goals, here's my fertility goals, here are my considerations, and now let's talk through what makes the most sense for me versus, okay, I see most people are on this, so I'm going to try that.
That's really interesting. So we really dove into, okay, this is what it would look like if you have a hormonal imbalance or a potential hormonal disorder and the steps you should take accordingly. But let's say someone doesn't necessarily think that they have a disorder or an imbalance. What would you suggest are just good practices to help nurture our hormone health that we can just do on a day-to-day?
Yeah, that's a really good question. I think obviously just living a healthy lifestyle is really important. And also thinking about, I know this is like very in vogue right now, but to some degree, stress management. I actually think some degree of stress management is not stressing about stress. So not like over stressing about all the things of how do I do everything perfectly and how do I follow the perfect diet, but just kind of figuring out what you're able to sustainably do on a day-to-day, I think is really important, because if you're so stressed trying to be on this crazy strict diet, in a lot of cases, it actually almost does the opposite of what you intended it to do. So I think it's really about finding healthy habits that you can actually stick to without them being overly burdensome or stressful on your life. So for example, for me, one of those is doing a ton of walking. I'm a huge walker. I love walking. I try to walk at least like 5 miles a day, but a lot of that for me is, I walk to work. I have this rule of thumb that if it's like less than a 30-minute walk, I always walk it versus take the subway. So I do a lot of morning walks or evening walks. I try to drink a lot of water. Drinking a lot of water is great. I'm trying to add veggies to every meal. Another thing I try to do that's actually really helpful with managing your blood sugar and your insulin is I always try to pair a carb with a protein. So think about, if you're having apples, maybe think about putting some peanut butter on your apple instead of just having it plain. I don't always do this, but it's something I try to do because it does help with those insulin and blood glucose spikes. So those are a few things. But again, all those things are pretty like easy to do versus, I don't follow a strict crazy diet. I eat dairy. I actually am a firm believer. And I think finally the trends are coming back this way, but I'm a firm believer actually that dairy, especially full fat dairy, is healthier for you than almond and oat milk. I like oat milk, so I drink it because I like the taste of it sometimes, but I'm always like, this is like my cheat, and the healthy version is the fat milk. So there's a lot of actually misconceptions there. Oh, oat milk is terrible. Like alternative milks are generally terrible for you. Milk is actually pretty good for you.
Why is that?
So why? One, I try to eat less processed food. I think that's really important. A lot of almond and oat milks are highly processed. A lot of them have added oils, and a lot of them have added seed oils or canola oils. A lot of them have gums in them, which are like terrible for you and for your digestion. A lot of them have added sugar, whereas milk, it has sugar in it, but it's natural sugar that occurs in it. It has protein in it, it has fat in it, it keeps you full. And there actually are studies that it can be helpful for some of your hormones because of the hormones. So yeah, we should be more, I know it's like the tides are finally turning, but I'm very pro dairy.
No, that's great. That's so good to know. Is there anything that we need to avoid that's top of mind that aggravates our hormone health?
I do think a lot about processed foods. I'm not the best at this. I'm trying to work on it, not just hormone health, but in general. I think the less processed foods you can have, the better, especially things that have like oils or gums in them. It's just not great. And not just for hormone health. I've been thinking a lot about, we've actually been seeing like colon, not to freak people out, we've been seeing colon cancer rates in young people really on the rise. And they think a lot of that is eating processed food. So as much as you can, just like eating more natural, less processed food, including some of those healthier alternatives, like the same thing, eating gluten-free processed muffins is worse for you than just having a slice of sourdough toast, in my opinion. As long as you're not intolerant to gluten and you don't have celiac. I think a lot of times we're doing these diets, but then we're having these crazy processed things that actually are making things worse for you versus if you just had the natural, unprocessed version of it, it might sound less healthy, but in a lot of ways it's way better for you.
Couldn't agree more. Even in my workplace, they really try to only allow healthy snacks in, but it's crazy. I'll walk over and I'll look at the ingredients for a lot of these snacks, and it's so upsetting that every single thing on the shelf, like no joke, every single thing have seed oil in them. And it's just becoming like really, really difficult to avoid if you eat any processed alternative, even if it's the quote healthy ones, as you mentioned. So yeah, I bring my breakfast and lunch every day because I know that even if it's a healthier processed alternative, unfortunately, in this society, it does have seed oil in it. You know, it's not even our fault. Often we think we're making the healthy choice because of what's advertised to us, and so many sneaky chemicals and additives are put in these things, you know, and it's, yeah, I'm super passionate about that, but that's for a whole nother episode.
Yeah, we could go deep on that another time. I feel similarly. I'm like, who did the marketing for all this, all these healthy foods that are actually much less healthy than just have the regular ice cream, don't have the stuff with all the chemicals.
Yeah. And, you know, we're just trying to do our best to be healthy, right? For example, like I've been drinking oat milk and almond milk, and I do look for the ones without the gums and all those things, but super great to know that, oh, I can just go back to whole milk now. But the information that we're fed is constantly changing too. One day this thing is super healthy, and then the next day, like, we're anti-broccoli. Like, what? Since when is broccoli like a negative thing?
Oh, why? Because it like is hard to digest? Why are we anti-broccoli?
I don't know. You just hear people like on keto, for example, and oh, broccoli has carbs. And I'm like, broccoli is literally the healthiest thing you could eat in my mind. Like, I'm confused. But again, we digress. Do you have any final words of wisdom or truths about women's health that you want to impose upon any listener today?
Yes. I'm going to give two things. I think one, like what we were just talking about, figure out what works best with your body and maybe do some trial and error to figure that out, because what works for other people's bodies is not necessarily going to be what feels best in your body. And so really kind of try to tap into, what am I eating that makes me feel better or worse? What am I doing in my day that makes me feel better or worse? What workouts make me feel better or worse? And try to evaluate it in your own body versus just ingesting all of this information that's coming in at you. And the second is to ask for testing. I think testing is so valuable, getting your blood work done, checking, again, not just your sex hormones, but like your cholesterol levels, checking your insulin levels, even checking, your AMH if you're looking to get a sense of your fertility. I think there's just a lot more that we can and should know about what's going on inside our bodies. It's actually very, very easy to test for. It's just a blood work test. It's covered by insurance. And I think more women should be testing their blood work and their hormones.
Amazing. Speaking of testing, if someone wanted to get tested with Allara Health, where can they find you?
So super easy to find us and sign up. We are at allarahealth.com, ALLARA Health. And you can find us on Instagram and TikTok at Allara Health and me at Rachel H. Blank.
Lovely. And everyone, I'll link that in the show notes as well. Rachel, thank you so much for taking the time today. I found this so interesting, and I know so many listeners did as well.
Awesome. Thank you so much.